welcome back to the Inside Dentistry with the Dental Student Society. I'm Dr. Astor Vas, your host, and today we have an incredible guest, Dr. Roman Batov, who has an inspiring journey from graduating dental school in Russia to getting into the prosthodontic residency at Tufts University. Not only has he successfully navigated the competitive US dental admissions process, but he and his wife have also built a strong online presence and founding a school of English for dentists and an admissions consulting company. Dr. Roman, welcome to the show. I'm so excited to have you here.
Thank you so much. Yeah,
Let's start from the beginning. You graduated from dental school in Moscow in 2022 and moved to the US the same year. So, what was this transition like for you and how did it get started?
yeah. Um, First, thank you for inviting me for the podcast for the video, and I'm very excited to share some insights with peers and with your followers as well. So, just to start with, I'm from Russia, from Moscow. It's the capital, and I really graduated like about 2 years ago. I think it's 2.5 years ago, and this journey was it wasn't easy, but I enjoyed it so far. Yeah. So first, why we decided to move is just because we saw much greater opportunity there in the United States, and also a year before my graduation, we won the diversity lottery, and that was like pretty good chance to start out there in America, having a green card, being lawfully authorized to work. And we started with moving and then working as dental assistants because my wife is also a dentist. We graduated the same year from the same class, and we both moved there and started working right away as dental assistants. I think this journey for me, it was like, of course, it was quite challenging because it's a new culture. It's everything new for me. But so far, so good. I think we did a pretty good job with like doing that pretty quickly. So I applied the same application cycle, like the very next application cycle after I moved to the US. Took me about 3 months to prepare for INBD, and then I already had the TOEFL passed back in Russia. But then I retook TOEFL and scored 107 in May of 2023, and the same application cycle was pretty successful for me. So I got into the residency. Also, I got into the advanced denting program in Rutgers University. Um, Overall, I got 4 interviews, and two of them were successful.
Okay.
Um, yeah, so and I decided to go to residency because I felt like I want to specialize, and I want to improve my knowledge in prosthodontics. That's my dream specialty. I always wanted to pursue. So I decided to go that route, and now I'm the first year resident.
Wow, that's amazing. And thank you so much for sharing that. So, you said you started working as a dental assistant. And so, how did that experience help you in your journey to like applying for residency program?
Oh, yeah, it actually helped a lot because I applied to about 10 offices. So when we came to the United States, first thing that I did, I went to Indeed.com, created my resume, and applied like to a lot of offices in the Seattle area because we came to Seattle, and I applied to a lot of offices, started going to different interviews, and then I found that office, and it was like an instant match because actually it was the only office where the owner actually invited me for a Zoom call, and we
Okay.
had a Zoom interview. And
Wow. Okay.
yeah, and then they just invited me straight to the working interview.
Mhm.
And we kind of started working the same day. I got an offer for a dental assistant position. and it was a really good periodontal practice. It was a specialty practice in the Greater Seattle area. It was one of the best ones. It's the leading periodontal practice in Seattle, Greater Seattle area. They have 3 locations, 6 doctors, and all of them were periodontists. So
Okay.
I was exposed to like the workflow of specialty practice. We also had prosthodontists coming in and doing some restorative procedures, some all-on-6 conversions and immediate loadings. So yeah, actually had a really great time. I learned a lot about US dental services, US like dental system, how things work, how insurance works, how billing works. So
Yeah.
a lot of things and how to communicate with the patients, how to like um, communicate with other dentists because it's also important. For example, when you go to the interview, it's really crucial to know how to like present yourself, how to sell yourself to the admission committee or to the professors. And this experience for a year in the dental practice really helped me a lot.
Okay. I love how you didn't just focus on your dental journey, but also started sharing something online. And how did you and your wife build a YouTube audience? What kind of content did you make?
So when we just came to the US, we thought that it would be nice to just record our journey and to like make some educational videos for people who also want to move, who want to like navigate this journey to like we started with just a video of how to apply for a green card lottery because
Okay.
uh, not everybody knows how to do that, and especially in Russian-speaking countries, English is not like popular, let's say there, because like you're from India, right?
Yeah.
Yeah, so like in India, I know that you guys speak English pretty well. In Russia, it's only about like 10% of people who
Okay.
really speak English. So it's difficult for them to understand what to do and how to apply and so on and so on. So we started with that. We also recorded our American life, started like doing some short videos. It was the time that when shorts just came to YouTube. So
Okay.
we started out with this short format and saw great potential in it and started doing this short videos about like pretty dumb things like uh, grocery shopping, about like um, street drugs. I mean, people were like all this crazy stuff in America that happens. And
Yeah.
this also gained engagement. So that's why we grew so quickly in
That's
YouTube.
amazing. And can you tell us what's your YouTube page called for those who are listening?
Um, my page is called uh, Window to the US. It's
Okay.
yeah, it's in Russian, but you can also find it by Window to the US.
Okay. Amazing. And I
Now
hope
we're not,
that,
yeah, we're not like active on this channel right now because like
okay.
we changed our direction then a little bit towards like professional side, towards dental audience. Yeah.
Okay. All right, for those who are listening, I hope that you guys go subscribe his channel and let's know more about his life as well up there. And now I didn't like, so you didn't stop just here with YouTube, right? You also started your English school for dentists and an admissions consulting company. And now diving into the big moment where you applied to advanced dining program and residency program. So what is the difference between the ASP and the residency program, especially while applying, and how did you strategize your application?
hmm Okay. So basically, so could you tell me what kind of audience uh,
Yeah.
listening to
So,
us? So how
so
aware are they about the admission process in the United States?
we do have people who are listening who have already been in the US and are in the process of admissions. And we also have people who are listening who are not yet started with their TOEFL or INP. They are totally new on what's the difference between just doing the DDS in US or and doing residency in the US.
Mm. Okay. Okay, I see. So let's start with just a quick overview of the journey of somebody who wants to become a licensed dentist in the United States. So basically, you either come to the US or you can do it from your country. But anyways, you have to come at least once for the INBD exam. It's the
Yeah.
comprehensive dental examination that includes all the areas and clinical aspects of dentistry. So that's the first step, is to prepare and pass the INBD. Also, there is the second exam. It's the English test called TOEFL. So then you go take TOEFL, then you apply. So, okay, the very first step before everything, it's doing your credential evaluation. And then with that credential evaluation, you apply to INBD, you go to TOEFL, and then you apply to dental programs in the United States. So there are basically two ways which you can go. First way is called an advanced standing program for foreign trained dentists, or for international dentists, or IDP program. It's kind of synonyms. So this program is a 2 to 3 year program that is focused on kind of training a foreign trained dentist the ways of dentistry is done in America. And this program includes like a general dentistry aspects. It's kind of the integrated program that
Yeah.
is integrated into the standard dental school curriculum in the United States. So um, like as a background, uh, in the United States, students go for undergraduate study for 4 years, and then they have to study 4 years in dental school. So advanced studying program is the last 2 or 3 years in dental school, because all foreign trained dentists are already licensed professionals in their countries.
Yeah.
In the United States, you have to go do just 2 or 3 years to complete your education and become a licensed professional and after that program you can pretty much get a license in any state, but New York has the different rules. You just have to do one more year of residency. So this is the general dentistry program for international trained dentists. It's specifically for them, for those who did dentistry back in their countries. So you cannot apply to this program as a US trained dentist, right? Because you have no reason to do that. And this program leads to it's a general dentistry education. So it trains you to do everything like basic procedures, fillings, like root canals, crowns, dentures, like all the basic stuff that general dentists do. If you want to go and specialize to study just one single area of dentistry, more like advanced,
Yeah.
become an advanced practitioner in the one single area of dentistry, you might choose going to the residency program. So it's basically a residency. It's the second step in dental education. The advanced studying program is the graduate study, and then the residency program is called a postgraduate study. So it's like
Yeah.
the next level. And people who study in the United States, they go to the residency after their 4 years of graduate study, after their dental school years. So so residency is usually 2 to 3 years, depends on the specialty. There are 12 different specialties in America. I think you know that.
Yeah.
I'm not going to name all of them. So I decided to apply to both of them, just to first to maximize my like odds of getting accepted, and second I just wanted to try, because before me I was told that residency, like, it's really hard to get into as a
Yeah.
foreign dentist, because you have your competitors, like US trained dentists, who
Yeah.
are better in English communication, who are better in like so many things, because they are like grew up in this culture, and like to in order to overbeat, or how is it called, like to stand out, you
Yeah.
have to like do much better. So but I decided just to give it a try, so I did. And actually residency, I found out that residency programs, they also have a lot of, not a lot, but some spots for internationally trained dentists.
Okay.
So it's really worth trying to apply to a residency program like if you feel that the specialty is some one single specialty is your passion.
Yep, and thank you so much for like driving or walking us through that steps in while applying to advanced standard program and residency as well. And I completely understand how competitive it is to like apply for residency schools and especially you getting into Tufts prosthodontics, right? So like how do you think it helped you stand out in your application? And can you walk us through the process of applying to residency as well?
Mhm. Sure. Yeah. So when applying to residency, you go to ADEA PASS application. So
Okay.
it's American Dental Education Association, and PASS it's a postgraduate application. So you go there, you can find the list of programs available online, and it usually starts in May, somewhere in like middle of May.
Okay.
Application opens, and you have to be prepared with your test scores, then with your transcripts evaluation, and what's most importantly, it's CV, curriculum vitae. Then you have to craft your personal statement, and then get some letters of recommendation from your professors, from your dental school back in your country, or from some professionals who you worked with, your mentors. So you have to really make your application stand out. And that's the most important part, to make your application really, really stand out, because everybody passes the tests. Eventually, everybody has INBD passed. They have like everybody has TOEFL passed. Um, like the average score is about like 100 plus out of 120. So you better score that high just to be competitive. But people with lower scores, they also get into the program. Like for example, one of my students who I personally coach and mentor just got accepted to the Prosthodontics Residency in Rutgers University this year with a score of 85 on TOEFL, and he actually did it in post-match process. So
Okay.
it's possible to do even with lower scores, and not with the best GPA, because he also had like 2.6 GPA, and which is like it's like there is a perception that in order to get
Yeah,
into
you need to
residency
have really
program,
good GPA
you need
as
like
well. Yeah,
3.5 and higher. But really, what matters the most is how your application stands out, like
yeah,
how comprehensive it is, what kind of applicant you are, and what what's your personal statement look like, what's your letters of recommendation look like.
yeah. And is there something like, are there any kind of tips in helping a person decide what kind of schools to apply for residency? Like, are there any things that we should really make sure we look into while choosing a school for residency?
Yeah, sure. Actually, in the residency, it's much more important to select really the programs you want to get into, because residency is more, let's say, like personal than advanced standing, because
Yeah.
advanced standing classes are much bigger, and also it's like in the general dentistry, they teach like more basic stuff other than in residency. In residency, they want to make sure that, and usually residency is even longer. It's like three, sometimes the oral surgery is like 4 years, 6 years. And
Yeah.
in residency, they want to make sure it's a small group. They want to make sure you really match with them. You really fit into that small group. So you have to select your programs wisely, and do your research. Also go to professional meetings. What I suggest, one thing that really can help a lot, if you pick a specialty, just go to their meetings, go to AP, go to ACP, go to then American Endodontic Association of Endodontics. So just go to their meetings and network, talk to the program directors, to professors, talk to the people, in that specialty. So you understand their vibe, you understand how they think, how they speak, how they what things matter to them. So that's one piece of advice I would give to anyone who just wants to apply to the residency program.
And that is a really important advice. Thank you so much for pointing that out. So, what about the licensure after just doing the residency for a foreign trained dentist?
So with the residency, it's a little bit trickier than with advanced standing program, because for advanced standing program, you can after you graduate, you can get a license in pretty much every state. But
Yeah.
in residency program, there are a few states who can actually give you a license. So these states include like Illinois, Texas, Michigan, and also like some other couple of states, Washington. So New York has their own requirements. So in New York, you can only you can only get a license only if you are a graduate from AGD program or
Okay.
GPR program, or you did advanced standing and then did 1 year of AGD or GPR. So you cannot, or advanced standing program plus 1 year of specialty. But if you just did the specialty program, you cannot get a license in New York. So they're kind of tricky. But like other states, the majority of states, they cannot give you a license, unfortunately, as a graduate from residency without doing advanced standing program.
Mhm.
But some states can give you a license reciprocally after you worked in one of the states that allows you to get your license, and like there is right away, I mean, after the residency. And
Yeah.
there are like about 12 to 15 states who can give you that license. It's like I definitely know about California and Utah,
Okay.
but there are also some other states that can also do that.
And those are the states which will give where you can work as soon as you finish your residency, is what you're saying?
Yeah, it's like Illinois, what I know, Illinois, Texas. Also, you can work in Michigan, Mississippi, Minnesota. Then
Okay.
what else? Washington. I
Okay.
know New Hampshire, Maine, Rhode Island. Yeah,
Okay.
I'm not
That's
sure for Rhode Island, but yeah, pretty
okay.
much all the states. Yeah.
Okay, that's really good to know. And looking back to how we have come far, like so far, what were the biggest challenges for you during your application process, and like how did you overcome that?
So the biggest challenge for me was to actually like craft this personal statement that would be like engaging to stand out
Yeah.
of the big pool of applicants. It was difficult to for me, it was difficult to get the letters of recommendation from my professors, because as uh, if you aware, the advanced programs, they require the letters written on
From the
like professional
professor.
letterhead, and
Yeah.
you have to ask your dean, and you have to ask your professors from your dental school. And like I'm from Russia, and for the past like a couple of years, Russia and the United States like kind of didn't get along.
Mhm.
And also universities were like afraid to
Okay.
schools were afraid to give such letters, because they just don't want to like mess up with their government. So
Okay.
it took me a lot of effort to get these letters of recommendation because of these political issues. But eventually I got them, and so I'm here.
That's wonderful. And truly, whatever you've shared so far is so inspiring, Dr. Roman. You've built such a unique path, combining dentistry, business, and education. So, what is next for you?
So now I'm working as like on my business, on the consulting company. We're mentoring other foreign trained dentists. We're focused currently on Russian speaking dentists, but we want to help more, expand more like internationally, and help other students as well. So we're doing pretty good job. We have good cases, and we're growing. So we have a small team, and now I think we'll do good.
I am
Also
sure you will.
doing my residency program, and after I graduate, I want to run my practice, of course, and now I'm considering like moving to either Texas or Illinois
Okay.
for practicing. So, but I didn't decide just yet. I've never been to Texas, but I heard good things about it, and
Mhm.
probably this year I will go and check it out. So.
That is wonderful. And so finally, what advice would you give to the foreign trained dentists who are applying for residency in the US?
My advice is just first, don't give up. It's possible. It's possible. Even if you don't get it from the first attempt, just try again. Don't give up. And second, my advice, I think, get this help, get support from the people already who already done this journey before you, because they know a lot more little details that you can miss, which can really impact your path and like make your application um, like not stand out, and which could delay your process of becoming a dentist in the United States, and also delay the the life that you want to
Yeah.
pursue as a foreign trained dentist in the United States. So really, I think it's much better if you, of course, if you like have some resources to invest in like help, just get this help, because like it can really make a difference and in your application process. So I think that it's really wise to invest in such like services and get help, because like if you don't do it, you miss a lot more. Because like what I'm looking at other people's applications right now, and like it's not their fault, but because they like some of them don't know English that well. Some of them they have like other different backgrounds, and
Right.
for some people it's like really difficult to navigate this process. So if you think you need help, just don't hesitate, just ask, get it. There are so many available resources online for free. Do your research. That's the most important thing. Just first, it's do your own research, and then find a person who you really like, who you want to get help from, who resonate with you, with your personality, and then just like go
Yeah.
for it.
Thank you so much for those kind words and the wisdom. Dr. Roman, you have an incredible journey, and thank you so much for sharing that along with the valuable insights today. Your story is definitely a testament to your hard work, your resilience, and just thinking outside the box. From being an assistant to being a resident today, from being a YouTuber to an entrepreneur. And I think for those watching, if you found this episode helpful, do make sure to like, share, and subscribe, and to stay updated on more inspiring journeys from foreign trained dentists. Before we bind up, Dr. Roman, where can our audience connect with you?
So you can just DM me on doc dot batov,
Right?
and yeah, so we can connect there, and so you can follow me. I'm currently doing a lot of content from my life, from conferences. I go to a lot of meetings in the United States. I really love it. I share a lot of like general insights on dentistry, on like my journey in the United States, the international dentist pathway in the United States. So I think you'll find it pretty useful, because now, as I said, I'm started posting more in English. So I'm a little bit shy posting in English, because like it's not my first language, but I'm trying. So please follow if you want.
Yeah, you are definitely doing great, and I don't think it does not sound like you're new to English at all. And thank you so much again, Dr. Roman, and best of luck on your journey in Tufts. And to our audience, keep chasing your dreams, and I'll I hope to see you in the next episode in Inside Dentistry. Thank you so much and have a good weekend, Dr. Badov.
Yeah, thank you so much for the invitation. It was a pleasure to meet with you. And guys, pursue your dreams and good luck.